Hello and welcome back. Today's video will be talking about different toothbrushing methods and indications for their use. I want to start off by talking about manual toothbrushes. And these are the most common device for removing oral biofilm, plaque, debris in the whole world. So everyone is familiar with a manual toothbrush. So the first method I'd like to talk about is our Bass method or sulcular method. So taking our model here, we would take our regular toothbrush. The bristles would be directed to at a 45-degree angle to the long axis of the tooth, meaning we're going to take our toothbrush, we're going to line it up at a 45-degree angle to the tooth. Again, we can see that here. We're making that 45-degree angle towards the gum tissue, but not touching it. Same thing, you'll make that 45-degree angle going downwards without touching that gum tissue. You can see it here and here. After we get that 45-degree angle down, you would go ahead and use gentle but firm vibratory strokes without removing the bristles from the area. So again, we'd make that 45-degree angle. We put some pressure and we brush and see how it kind of molds right to the gum tissue. It follows that, and we're going to focus on 2 to 3 teeth at a time and giving some gentle but firm strokes. And we go across like so. So this is our Bass method. And this is indicated for general toothbrushing, people with periodontal disease and periodontal maintenance. So because those bristles, they can get about a millimeter underneath that gum tissue. Millimeter to 2 millimeters, I'd say. The next method I want to talk about is the Stillman method. Now, the only difference from the Stillman and the Bass method, we're still making that 45-degree angle on the tooth, but we're engaging that gum tissue right above the tooth as well. So you're going to go a little half and half. So half on the tooth, half on the gum tissue, you can say. So we can see here. So half and half. And this stimulates the gum tissue is the difference. We're stimulating the gum tissue. Again, it's good for patients who have some gingival recession and need some, or patients that need gum tissue stimulation to keep that gum tissue taut. And we can go across, doing both. And the Stillman and the Bass method are indicated for mostly for adults, is who I would recommend that for. Now, the next method of toothbrushing, we can go to our pediatric model here, or our model for little kids. This is the method of brushing for little kids. We call it the Fawn's method. And with the Fawn's method, they would take the toothbrush. So I have a tiny toothbrush here, and they would place it on the tooth, like so. And they would do little circles, little circles. Again, this is due to them being, small people. It's tougher for them. They don't have as much developed dexterity as an adult. So this type of toothbrushing kind of enters them into their brushing story, brushing habits. Again, those little toothbrushing, little circles. It just helps them get a start in toothbrushing. Otherwise, we don't recommend it for other patients. The next method I'd want to talk about is our Charter method, and that involves patients who are in active orthodontics. So I have an orthodontic model here. This method, instead of making that 45-degree angle above the gum line, we're making that 45-degree angle towards those brackets. Since those are the area, that's the area that we're trying to clean. So we make that 45-degree angle, we do those vibratory strokes, back and forth just to clean around those brackets. Again, focusing on 2 to 3 teeth at a time, going back and forth motion, giving some good pressure, but again, not too much. Do those bottom front teeth. This is a proper way to clean those ortho appliances. So next I want to talk about our electric toothbrushes. So the most two common models I pulled out here are the Oral-B model, which has the round spinning head, round brush, you can see here. It just spins. And then our other common one is the Sonicare. It's kind of like a regular toothbrush head, except it vibrates. So the difference between these two, with the Sonicare, you just kind of have to place it on the area, and you might still engage it. Lightly engage. Again, you can use your same circular method or Bass method. You can use that Stillman method. Again, you're just placing it instead of scrubbing, actually, because the toothbrush is going to do all the work. You take it across. Again, you can go to the bottom. And you can also do the Stillman again. Like I said, you can just place it on the top. Half is touching that gum tissue, stimulating, and half is getting on that tooth. So it's a nice toothbrush. People prefer this one. And you're getting a lot cleaner than if you would with a manual toothbrush. And we do have a bunch of different settings we can go down. Next, I'm talking about the Oral-B toothbrush. Again, a much smaller head. So this one, we can still do the same. We can do the Bass method, the Stillman method. Only difference is it's a smaller brush head, so we have to focus on one tooth at a time. So I would turn this on. Again, you do one tooth at a time, go across. And that's the technique you want to use with this toothbrush. If you go across like this, you're not going to get an adequate cleaning. You want to do one tooth, place it. One tooth and place it. And you just do that across all areas. Again, you can do the Stillman. You can do half on the tooth, half on the gum tissue to stimulate it. And there are a couple different heads that can be used. And this is generally more preferred by like dental professionals, just for the fact it's more like a polishing. When we do a polishing, we focus on one tooth at a time. We have a smaller, rounder head. Again, both of these toothbrushes are also adequate for orthodontics. So same method. Instead of doing that Stillman or Bass method, you're going to do the Charter method. You'll take that toothbrush, face it down. You go towards the brackets. A little harder to control with the Sonicare here, but you get it in there. It does a good job of cleaning up those brackets. Your orthodontist will thank you. You can see you can get in there, cleanse everything. And let's show it with the Oral-B here. Same thing. You're going to turn it on. You're going to do that 45-degree angle downward with the Charter method on those brackets. Well, and I just covered today the most basic toothbrushing methods. There are some more advanced ones we'll cover in the next video. So again, I use that electric Oral-B, that Sonicare, and the most commonly used toothbrush out there is just a regular manual toothbrush. There's lots of different ways to brush. As always, it's good to brush 2 times a day, every day. That's just to remove the biofilm that builds up on the teeth in the mouth every 12 hours. So that's why we brush 2 times a day.